I found out that I am one of the luckiest people in the world.
Now it's, not a big deal. I do everything that my friends do.
I felt better, truthfully, in 2 weeks.
I felt good from the time I got into my room to today.
You talk about the convenience or inconvenience of a transplant. A transplant keeps you alive, so anything it takes to keep the transplant going is worth the trouble.
You have a team. You have all these medical professionals that are your team members, but you are captain of the team.
Be proactive. You have to be a participant. After all, it's your body and it's your life.
People are unique, and transplant patients are no different. They tell a variety of stories, but their message is one of hope.
Right afterwards, I just remember when I woke up crying, and they told me that the organ was working, and I just remember crying and just felt like weight had been lifted off my shoulders.
I want to do all the normal things that I just didn't have enough energy to do before.
What happened after the transplant was like a whole new world that I was living in.
I was alive, I was happy, and I was just grateful that it was working.
The journey from illness to wellness has been traveled by many who are now living healthy and happy lives. There is no single way to prepare for life after transplant, but knowing as much as you can will help you on the road to recovery.
It's a scary time because here they've maybe just gotten used to being on dialysis or coming to grips that their kidneys have failed, and now we're giving them a transplant. It's a whole new set of rules and lifestyle maintenance that they have to learn, and they want to do the right thing.
When you're released from the hospital, they give you a whole new set of instructions, and some of them you have to follow to the T.
We give them a nice big fat book with lots of pictures in it to try and help them through the education process, because this is getting a very complicated, expensive, fairly high maintenance piece of equipment that we want to last for the rest of their life.
If you read it, it is very, very helpful because it'll tell you from past experience what things you should look for.
Most patients leave the hospital feeling physically better than they have in years, but they may have some lingering concerns.
Fear is the biggest, and they're just scared that they're going to do something wrong.
I think when you have a transplant, any little change in your body kind of gets you thinking like,
You just have to be observant, and anything that seemed abnormal to you, you need to discuss with the doctors or your transplant coordinator.
Rejection is very uncommon. It's about maybe 5% of patients will experience some rejection, and almost all of those we can treat now with medication by just readjusting the medication doses.
There is a lot to know, and it helps to remember to be calm. CALM stands for communicating with your transplant team, family, and counselors, making and keeping appointments, getting lab work completed, and taking all your medications. Use the CALM prescription as a simple reminder to take charge of your health.
Transplantation is a treatment, not a cure. So it depends on taking your immunosuppressive medications for the rest of your life. It depends on having close follow-up with the transplant program, which includes getting your labs on time, contacting your coordinator if you have any questions, and relaying any new problems or information.
I just tell them to stay calm.
Communication is important. Stay connected to your transplant team. They are there to help.
We have coordinators on call 24 hours a day, 7 days a week, 365 days a year, and their job is to make sure that they answer the phone and answer any questions or concerns.
The coordinator is always in contact with you, your blood work. They'll call you, say, we want you to reduce this amount of medication, or we notice this is elevated.
It's a wonderful feeling to be able to contact them with anything I have that I'm worried about, or to know who to contact or what to do.
Communications is a key. We want to hear from you, and you're going to hear from us if we don't hear from you.
I will not know if something's going on with them unless they tell me. Nothing's a stupid question.
I'm going through it once, and they've gone through it many a times, so they've got the procedures down pat. They know what they're doing.
I kind of feel that we're a family, and now the patient is entering into our family, and that's how, we treat you.
She said, we will be your family for the rest of your life.
I have many people that are 20, 30 years out from transplant that we still watch their labs, take care of them, see them in clinic. So this is a lifelong commitment between a patient and their transplant center.
We're not alone in this. Barnes cares. It's an amazing feeling.